Assalamualaikum and a very okay. Hi, Assalamualaikum and a very good afternoon to everyone. So my name is Dr. Nobre Diabetes Ismail. So for today, I will talk about diabetes. So how does reducing electron therapy can help most of the diabetes patients? So why I choose the diabetes topic for today is because as you all know, diabetes is one of the common disease that lead the mortality rate very high ranking in Malaysia. So don't be surprised if, let's say, one of your family members or one of your closest friends also can have this kind of diabetes. So you need to know what is actually the diabetes are, and what are the causes of it, and how the treatments can help diabetes patient, or the other alternative treatment, which is reducing electron therapy. So basically, diabetes, as we can say, is a common disease because you can see everywhere you go in the hospital. Also, some of the maybe your family members, your parents also can have this kind of symptom diabetes. Okay, so you should know which one is the diabetes, which one is obese. So most of the most of the patient, they doesn't know how to differentiate between diabetes and obese. So diabetes and obesity is two different things. Okay, so again, for this week, we talk about diabetes. All right, so here, I just want to share with you, this is one of the articles that I found out in the website recently regarding diabetes. So you can see the first article on your left side, which is from the health ministry itself. It said clearly, nearly 1 in 5 Malaysians have diabetes. So you can see how common this kind of disease that could lead death. So because of this, you can see 1 in 5 Malaysians people has diabetes. All right. So for the second article, you can see that this is just I want to share with you. Even though this article is quite long time, it's 2015, but this is the you can say this is a recently research. So diabetes care in Malaysia, the problem, the new models, and the solution. So as you can see that, you can see the abstract, the background. Diabetes is a major public health concern in Malaysia, especially diabetes type 2. So you should know, diabetes we have two types, which is type 1 and type 2. And also we can say that diabetes among Malaysian people have increased to 20.8% every year. So can you imagine, let's say we have like 7 million we have like billion people in Malaysia. So you can see every year have 20.8% increasingly. So could be one of your family members, again, your family members, your siblings, your friends could be have a diabetes. Maybe not a very serious diabetes, but if a mild symptom, it also can lead to death if, let's say, you didn't take care of yourself. All right. So this is the article I find out. So after that, hold on. Okay, so what is diabetes? Okay, you should know what is diabetes again. If let's say you doesn't know, then how you want to control it, correct? So basically, diabetes is blood sugar too high inside your body. That means it doesn't mean you eat sugar, you have a diabetes. No, it means that if let's say your body cannot control the sugar amount inside your body, yes, you can have diabetes. Okay, when this is happen, your pancreas, okay, the pancreas not able to produce insulin. Okay, later we'll go more further about pancreas and insulin. All right, so but again, diabetes is a blood sugar very high in your body. And then your pancreas is pancreas is the main component that produce insulin to control your blood sugar. So if let's say your insulin is not good, not producing very well, that's why you have diabetes. All right. So diabetes have 3 types, which is type 1 usually is occur in child and adult because they doesn't have enough insulin. Type 2 common in adult. Okay, usually we can see like our parents, among adult or old people, they have the insulin, but they doesn't use the insulin. Okay, you guys can understand, right? So again, I repeat, type 1 usually occur in child or adult because the pancreas doesn't enough produce insulin. For type 2, common in adult, which is your parents, your grandparents or whatever, so it's produce insulin, but the body doesn't use the insulin. So that's means the insulin is like inside our body, but we don't use. So that's also we have can have diabetes. And the last one, GDM, gestationals. So this one usually among pregnancy, among mother who have a child, so high blood sugar, high blood glucose during pregnancy. Okay, remember we have 3 types, type 1, type 2, and GDM, usually on pregnancy women. All right, so this is what I want to show you is the causes of diabetes. After we know what is exactly diabetes, and you should know also of the type of diabetes, now we need to know the causes of diabetes. So causes of diabetes, I just separate by 3 types of diabetes, all right? So the first one, GDM. Remember, GDM is for pregnant women. So basically, the causes is we unknown because the risk factor can increase the chances to get diabetes. But again, the causes is unknown. We also doesn't know what are the exactly causes, but the risk factor. For example, you can see the pregnant woman usually they gain weight because they have a lot of appetite to eat. So that's why they gain weight. So this risk factor, which is the gaining weight, can lead to diabetes if let's say they cannot control themselves. All right. So the second one, type 2. So type 2 usually is a genetic. It's come from your family, long time family. So if let's say from genetic, it's quite difficult to treat, but it's possible to you control your diabetes. That's why your body become resistant to insulin. And last one, type 1, which is your immune system destroying the cell in pancreas. That means, remember the pancreas I said just now? Pancreas is produce insulin. Okay, for type 1, usually the cell inside the pancreas is already destroyed. So that's why you have a type 1. That's why among child also we have this kind of diabetes. All right. So this is the treatments available for diabetes, which is we have a type 1. I just separate for 3 types, so easy you understand. Type 1, type 2, and GDM. So for type 1, usually we use the simple one. Rapid acting insulin, short insulin, intermediate, and long. So this one is usually for injections. All right. For type 2, is glucoside, alpha inhibitor, biguanide, TPP inhibitor, glucagon, and saccharose. This one usually we taking by oral. Usually oral. Okay, so this one it depends also. Type 2 is depends whether first stage usually we give the medication first by pills, by oral. If let's say the pills or oral is still you cannot control your insulin, your diabetes, then we can give the shot. All right. So for the next one, GDM. For GDM, we cannot GDM, remember, for pregnant women. So for pregnant women, usually we doesn't give any injection or any medication. Why? Because we afraid we will affect your baby. So usually if let's say it's too high, you just can say change your diet. Usually pregnant women, we doesn't give anything usually, but usually we just advise them to change the diet. All right. Okay, so this is the side effect after the treatment. So you can see that after treatment, every single medication in the world, you can say in the world, has their own side effect. So how to control the side effect, later we discuss again. All right, so the side effect of the medications is, of course, first is nausea. You feel very nausea, and after that you will come with a headache. So when this thing comes, you will be having a diarrhea and also weight gain. So that's why you can see some of the diabetes patient is very big. It's due to sometimes due to the medication they take, and also stomach pain. And after stomach, it will be slowly going down to edema. Edema is swollen on the leg or the swollen on your ankle part. Okay, and then you always feel thirsty. It's sometimes now you eat like 1 glass of water. Maybe after like 20 minutes, you feel very thirsty, so you drink more water. So that's why it can lead to edema also. And the last one, skin rash. So sometimes you can see some of the diabetes patients have like redness spot. The redness spot. That one is a skin rash. So these are the side effect, normal side effect after they're taking medication for a long time. So that's why I said how to control it, how to overcome this kind of side effect. Later we discuss. All right. So this is the complication of diabetes. Okay, again, remember just now earlier I said the causes of diabetes is one of the causes high mortality rate in Malaysia due to the diabetes. Okay, it's not you die due to diabetes. You die sometimes due to the complication of diabetes. What are the complications are? So you can see I have 5 major complications I want to discuss about. So the first one It's a slow healing. Okay, as you all know, sometimes diabetic patients, you can see like they have their wound, sometimes in the hand, on the legs. So why they doesn't have enough? I mean, like the wound is not recovered because they have a slow healing process, because their immune system is not so good. So that's why they have a slow healing. So then for the last resort, the doctor will leg amputation. That means they're cutting the legs. All right. And the next one, nerve damage. So sometimes this is usually we can say among the mild. I mean the early stage of diabetes. The nerve damage is sometimes you suddenly your toes or fingers sometimes feel numbness. Even though you sit for too long, you can feel the numbness. So for diabetes, it's more. There can more sometimes frequently numbness. All right. The third one, heart and blood vessel disease. So of course, when you have too high sugar in the blood, of course you have a stroke, high blood pressure. So these two is a common thing. All right. And the next one is a kidney damage. Yes. When your sugar very high in your blood, in your body, your kidney cannot process the glucose. Remember last time I already said in the previous week regarding the kidney. So if let's say glucose is very big, so the kidney cannot process the glucose. Glucose is sugar, right? So that's why to lead kidney failure. And the last one, skin condition. Okay, again, skin condition have connection with the slow healing. Remember the wound I said just now? If let's say your skin have a wound, it's very slow healing. Very slow healing. So that's why the bacteria can produce themselves in the mouth skin. So that's why you have these skin conditions. So again, complication of diabetes have 5 major: slow healing process, nerve damage, heart and blood vessel disease, kidney damage, and also skin condition. So these are 5 major complications that could lead death. So it's not diabetes, you having diabetes, you die. No. Sometimes the complication of it that could lead to die. All right. So I'm pretty sure most of you will wonder, how does the complication diabetes occur? So usually I can simply say these 4 factors. Because your body have a lacking oxygen and intracellular acidification. That means your body cell is too much of acid. All right. Supposed to be our body should be alkaline, not acid. So if you say your body have a lot of acid, so that's why you can have this kind of symptom. And third, immune system is suppressed. So immune system, again, remember last time I already said immune system is a white blood cell, all that. Okay, so white blood cell is very low. So you also can have diabetes. And last one, increase the inflammation of level. So your inflammation inside body very high. So these 4 major factors that can lead diabetes to occur. All right. So now, after we know that what are diabetes are, the type, the causes, the side effect of treatment and the treatment, and how does the complications occur, I want to show you one of the alternative treatment that can heal. We can say heal and help reducing heal and help this kind of complication. So we call as reducing electron therapy. This is one of the therapy that can help most of the diabetes patients. So what is it? So basically, I just say REP, okay? That's the synonym of the words. Okay, basically, RET is a biochemical reaction that giving negative ion towards your body. So basically, it's not a very dangerous. It's not a medication. It's not an oral product. No, it's just an electron. Electron negative charge towards your body. That's it. All right. So the main effect of this treatment is 5. We have 5 major, which is regulation autonomic system function. That's when you control your heartbeat, breathing, your sleeping pattern. And second, proper hormone function, your hormones. Third, immune system will be increased. Fourth, homeostasis. Remember, homeostasis is the cells. So improve your cells conditions. Last one, improve your blood circulation. So that after using electrotrophic, you can feel this 5 of effect. All right. And this is, I just want to show you, this is, we can see the blood inside your body. So you can see the right on the left side. This is the abnormal red blood cell. So you can see positive and negative side is clamping. So it shows that your blood circulation is not good at all. All right. So after using the therapy, you can see on the right side, normal red blood cells. So we replace the positive charge with the negative ion. So you can see when your negative charge is fully around your circle red blood cell, so it will pull away. So this is what we want. Okay. Okay, this is I just want to highlight what are reducing electrotrophic can help most of the diabetes patient. So first, of course, enhance the process of diffusion sugar. Okay, remember the sodium and the insulin part. Okay, this is we can say this is a specific way. All right. Second, optimize the intracellular and extracellular preparation. That means optimize your cell body. And third, balancing your immune system. Again, remember I said just now, immune system will be suppressed, going very low. So this treatment can help to balance back your immune system. And the last one, promote wound healing. So that means your wound healing will be more faster. So these are 4 major factors that reducing electrotrophic can help most of the diabetes patients. So how they can help? So this is how 4 major steps, how the insulin effect. So reducing electrotherapy will increase the effect on sodium and increase the cellular interstitial fluid, which is your cell body. And you can see the differences between pH, intracellular is 7.35 and extracellular is 7.44. So when this is 3 factors is happen, your blood glucose level will be improved. Okay, remember the pancreas produce insulin. So this is what insulin do inside our body. All right. Second, this is a very important one. Okay, reducing electrotherapy can improve diabetic chronic complication. Okay, the diabetic chronic complication, that's mean like the wound, remember just now, the wound in the legs, on your hand, it be more faster to heal. So I just simplify in 3 terms, which is microangiopathy, macro, and also diabetic foot. So micro, usually you can see some of the diabetes patients, they cannot see very well. They cannot see very well because of the eyesight is very low. Okay, so when you use this treatment, it will improve in energy metabolism and also antioxidations. All right. For the next one, macro. So usually the patient have a heart disease or cerebrovascular will improve in terms of arteriosclerosis. So arteriosclerosis, last time I already said, arteriosclerosis is the blockage blood vessel. So it improves on in terms of that and also have antioxidation. And the last one is a very, very important one. Most of the diabetes patient will have diabetic foot. So diabetic foot will be improvement in terms of peripheral blood flow. So when improve your blood flow, your wound healing will be more faster. Okay. Okay, so now I will show you the clinical study that we have. Okay, so you can see this is diabetic gangrene. So you can see the before treatment on your left is a male 864, okay? It's collected in the Kawaguchi Clinic, Japan on 2014. So you can see the before treatment and after. So this is the part that I said to you just now, the wound healing. You can see before treatment, the wound healing is very low and you can see like almost want to amputate. But after the treatment, after 6 months of treatment, the part who are, how to say, the wound is there and the bacteria become healed. You can see this part, more faster healing by under 6 months. And this is one of the patient also, female 94 years old, okay? This is 94 years old. You can see the wound before the treatments. This is a very slow, how to say, it's a very slow healing after the 1 year because it's a very bad one. After 1 year of treatment, you can see the same part we take much more better, and the skin also improve. So that's why I say among diabetes patients, usually they have like this kind of wound. We call as the maybe the necrosis or that the cell is dead. So that's why they have a very slow healing process. That's why this treatment, reducing electrotherapy, will help this kind of to heal the wound, so that no need to amputate your legs or whatsoever. So bacterial infection also lesser after that. So this is what reducing electrotherapy can help. So conclusion, okay. Basically, glucose go to the cell by insulin. So glucose is the sugar. So that means the sugar go to the cell by insulin. So insulin is like our transportation to bring the glucose to the cells. And when this is happen, the glucose will burn energy. So when we walking, we talking, we move, the glucose is burn energy into the cell. And after that, the glucose is converted to energy. So that's why some of the athletes, they eat sugar more because they want to convert this glucose to the energy. So bring more energy, So that's why we can see like among above 50 years old, they have to say it should be the need to eat less sugar lah. Because if let's say they eat more sugar, but they doesn't convert to energy, so that's why they have that kind of diabetes, because they doesn't know how to use their energy. So by using reducing electron therapy, it helps this process to go smoothly. All right, it goes just smoothly. It doesn't go like, like it doesn't have a problem with this. So this is what reducing electrotrophy can help most of the diabetes patients. So this is our product is 100% imported from Japan. So if let's say your emails, this is our email and hotline number. If let's say you have a lot of questions to ask, I want to know more regarding this treatment, you are most welcome to contact us with your email and the hotline number. All right, so thank you so much for everyone listening. So any questions? So any question, I would like to answer your question if you have any question regarding diabetes or the treatments.
Yeah, doctor, I got one question here.
Yeah, okay, sure.
Well, is it the diabetic because of the insufficient insulin?
Sorry?
Because insulin, the diabetes is because of insufficient or pancreas does not release insulin. Am I right?
Okay.
You hear me? Hello?
Hello?
You hear me?
Yeah, Mr. James. Yeah, Mr. James.
Okay, what I mean is the entire root cause of the diabetes because of insulin, the effectiveness of the insulin and also the sufficiency of the insulin. But how can this MI energy can replace the so-called pancreas on insulin release?
Oh, you mean you want to ask how this insulin is helping the how the treatment is helping the insulin? Is it like that?
Yeah, I mean, you see what's the relation with the reduction energy versus the pancreas functionality?
Oh, all right, understand. Okay, so let me get back to the slide. All right, hold on. Okay, so just now you're asking me, Mr. James asking me, how does this treatment will help the insulin effect to our body, right, Mr. James?
Yeah, right.
All right, so these are basically the slide. Okay, first, as you can see here, we just increase the insulin effect. So that means reducing electron therapy will help to improve insulin effect in terms of their producing. So remember, I said just now, pancreas is we can say, for example, pancreas is like a factory. The factory is produce insulin. So if let's say you use the treatment, so the treatment gives the working a push at the pancreas to push more insulin effect to go out from the factory. So that's how reducing electron therapy help the insulin more go out further from the pancreas. So when this happen, the glucose whatever inside your body will help to reduce, will help to convert to energy. So when you use the energy, so that's why you don't have any problem with diabetes. You don't have any high blood sugar. Usually diabetes patients have high blood sugar because their energy doesn't use. They doesn't use the glucose. That's why most of the diabetes patients we can see like a big size and they are very slow movement because they doesn't use their energy. So you can imagine, let's say you eat more sugar and you didn't use at all the sugar, just stuck in your body. Your insulin production also stop. So that's why your body become very big and you have a slow movement. So in terms of this therapy, it helps you to push the pancreas to produce more insulin to convert the glucose to energy. So how to say, if let's say you come to our place, last time we do have two to three diabetes patients. For the first comer, they say they are very slow. They're using a tongkat to walking. But after a few months, they're using our treatment. They can walking by themselves, still using a tongkat, but more faster walking. So that's how we convert the energy. So far, Mr. James, did I answer your questions?
Partially,
Oh, partially. Oh, okay.
because
Anything else? Okay.
because the so-called insulin being produced by pancreas.
Diabetic. Okay. Come
Yeah,
again, Mr. James?
That means the insulin produced by pancreas.
Pancreas, okay. Insulin is okay.
Yeah, but in certain cases, the insulin is the pancreas is totally malfunction or even non-function.
Oh,
So
no function, okay.
this one will not have, right?
Oh, okay. Yeah, I do have some of the patients who are the pancreas already, we can say broken. We can say pancreas is rosak, okay, totally damaged. Okay, yes, that's why we can see some of the diabetic patient will like injection the insulin to the stomach, correct?
Yes.
Okay, so you're asking education, how does this treatment help the injection part, correct? Mr. James?
Yes, right.
Okay, so that's your
Yes.
answer, correct? All right, so basically, this reducing electrotrophic negative ion, we just focus on how to say the electron is focused more to the insulin. So if let's say your pancreas doesn't come out any insulin, it just depends on the injection. So this treatment in turn help of how to say making the insulin movement more smoothly. So that's mean they carry out the insulin part. They just bring the insulin part to the every part of your body have needed. So that's why we can see most of diabetic patient have a diabetic foot. Remember just now the wound slow healing. So that's why I said they doesn't mean you use this treatment your diabetes is very low. Your diabetes can be cured. No, it just help you in terms of the complication. All right. So you can understand this part, Mr. James?
Yeah, it means that even for specific case whereby the patient who where the so-called the pancreas totally broken, but they can using this VI energy, but at the same time they should also continue inject insulin.
Yes,
Right?
correct. They should.
That's
It
right.
doesn't mean like you use the treatment, you need to stop the injection. No, still
Yes,
continue.
yes.
Still continue the injection part. So maybe we can this treatment can less in terms of the side effect of the medication. The side effect, remember just now I showed the skin rashes, the headache, the nausea. So we can reduce in terms of that. So it doesn't mean if you say you use the energy, you need to stop other medication. No, we need to be how to say bring along together. Bring along together. That's the thing. Yes. So you can say some of the worst, no, not the worst. Some of the issues last time we have, we can say one of the patient, it reduced the insulin injection from the last time we took usually 6 times a day. But after I met her about three months after that, now her insulin just reduced until 4. 4 times of cucuk. That's why I say some of we can say miracle. It's a miracle thing. If they say your insulin is 6, starting is 6 cucuk treatment, and after that it will reduce can become 4. So we have to say this treatment can help in terms of that also. Reduce the insulin infections.
Okay. So the diabetic patients supposed to continue use the injection insulin, even though together with diffusion electron, there's treatment.
Yes, correct. Yes, correct, Mr. James. Yeah. I didn't suggest that the diabetic patient need to stop the medication, need to stop the injection. No, they should continue all the same, plus the treatment, so that we can say have an optimum effect after that to become more healthier. That's the thing, correct?
Okay, now I understand this.
All right, Mr. James. All right, thank you, Mr. James. Any other questions?
Yes, I have a question.
Okay, Madam Lai. Okay, hi, Madam Lai.
How is this treatment delivered?
Oh, basically our machine is like via hand and legs. So we doesn't mean oral, no orals, no injection. It's just like just simply you rest in the on the sofa, on the bed, on the chair. So we deliver the machines. So you need to know how the machine operates itself. Later, Shirin will introduce you the machine. How does the machine how to operate the machine? How does the electron is entering your body? Later, Miss Shirin will answering your question. Is it okay with you, Madam Lai?
I didn't hear you. That. What do you say?
Oh, sorry. Actually, the machine is, we didn't use oral, no oral,
Right.
no injection. You just simply you rest, and the machine, the negative ion will enter from your hand, both of your hand, and also your legs. So you want to know how the machine looks like?
Yeah. Do you have a picture?
Yeah. Later, Miss Shirin will share to you after my part. After this, Miss Shirin will show you how does the machine looks like. Is it okay, Madam Lai?
Yeah, okay.
All right. So any other question regarding diabetes?
No.
Oh, okay. Any other from other sides? Okay, so I believe doesn't have, so Shirin?
Okay, thank you, Dr. Fida.
Welcome. Thank you so much for listening.
So I will first answer just now the question from Miss Lai about the machine before I proceed to the sharing. So you've asked about the machine just now. So actually we have two machines. The left side is what we call Me Energy, the bigger machine, and then the right side is the IGE1J, which is the blower. So the difference between these two machines is only how we introduce the reducing electron into our body. But both of these machines actually produce reducing electron at the same time. So for the Me Energy, what we do is you can see there are 6 plates here. So we will just put this plate on your body. So how does the reducing electron go into your body is through this plate, go through your skin, and then into your bloodstream. So your blood will carry the reducing electron to all over your body. So this is the usage for the Me Energy, the big machine. As for the blower, it produces the reducing electron through like air. So what you will do is you breathe in like normally. So when you breathe in the reducing electron as well. So for this blower, it's very good for those people that has lung problems or like heavy smoker, because it will help them to strengthen the lung, to clean out, to filter all the toxins and also the dust from the lungs. So what we normally do when we perform the treatment is by using both of these machines together. So you will get the maximum effect from the reducing electron treatment. So you will have the big machine to target your whole body and the blower to target your lungs. Ms. Lai, do you understand the application of this machine?
Yeah.
Yeah.
Hello.
Yes.
Okay, I will say in the IGE1J, there was the time I admitted in hospital Salam, 35 days. I going to ICU 6 days. So I'm very weak, my lungs problem. So that they put the pipe to my lungs there to get it out all the dirty blood. So that Madam Yi provide me one blower machine. That is perfect. Don't know why. I not feel pain. My lung is recover is very nice. Only for blower, and every day I wearing the Pampers. So my backbone, nothing. normally some is wearing 1 week. The backbone there is already got the something's ready, right? I got nothing. It's very, very nice. So that this is the one. Only the blower put in my room there. Just blow 24 hours non-stop. This is the one I want to share. And the other one is maybe last few years I used the eating machine one is in the Damansara Intan daycare, morning until evening, more than 8 hours. I sleep until no lunch, 7 or 8 hours I sleep totally. That's the use the me energy. Suppose the doctor say I need to chop my leg already. So use 2 months, the black color all is reduced. And the other one, I use the 6 months. So the one is going down to hello. Hello.
Hello,
Hello.
can hear, you can speak.
Okay. Then it's going down to 7 already. Okay, my sugar level. So 6 month time. Was time Jenny know already? She helped me every day, morning until evening. She doing that. This is very fantastic. Until I come back here, 35 days. I come back my house here. I continue use me energy and blower. Only one set. Now is the finally next week is the 6 month ready for my medication, everything. Well, doctor didn't say anything. The next Tuesday, I will go to the finally X-ray. Maybe it's a good news for me. I can go back to work. Thank you very much.
Thank you for the sharing. We will have more sharing later. So for now, I'll just proceed with my part, which I will share about research done by Dr. Nobre on diabetes. So this one is Dr. Nobre, which is also the founder for this reducing electron treatment. So actually he did research on diabetes in itself. So I extracted some of the info to share with you all on this diabetes. Okay. So from Dr. Nobre, he actually mentioned that when cell metabolism is poor, blood circulation will be poor as well. And this is the proof of weakened cells in our body. And he see that the cells of the diabetes patient are exactly like this, which in diabetes patients, their cells are poor and their cell metabolism is affected. So maybe you wonder what is actually cell metabolism. So we can see here the picture. The left side is arterial blood. This blood helps us to transport all the nutrients, the oxygen into our cell. So this is our cell. And on the right side, we have the venous blood, which help us to excrete all the waste, the toxin, the lactic acid, our carbon dioxide. Okay. So for a normal and healthy blood circulation and also cell metabolism, we should be able to absorb all these nutrients and oxygen into our cell. And then we are able to excrete all these carbon dioxide, waste, lactic acid, toxin out of our body. So let's say something happens in our cell. Our cell cannot function well. It cannot carry out metabolism as normal already. So it will affect our blood circulation as well, which is why we can see the diabetes patient, their blood is not that nice. They have a lot of acidic and also toxin and waste in their body. It's because of their cells are weakened, their cell metabolism is poor, and then causes their blood circulation to have problem as well. Okay, so here for a healthy cell, you can see for a healthy cell, normally we have oxygen absorbed in and also our nutrients. And here you can see we have glucose, fat, and protein. Okay, so for a healthy cells, it can actually convert all these nutrients, our glucose, our fat, our protein, into energy through cell metabolism. This is for a healthy cell. So let's say if the cell is not healthy, what will happen? Maybe it will take in all the nutrients, but the most important thing is the cell metabolism, it cannot be carried out. So when the cell metabolism cannot be carried out, all these nutrients will not be converted into energy. So the nutrients will be stuck inside the cell. So for long term, you can imagine all the nutrients is stuck inside and keep accumulating, collecting inside the cell. So for a long time, the food, the nutrients that it absorbs will slowly be oxidized because we have oxygen in our body. Every day we breathe oxygen, right? So this oxygen will oxidize all the nutrients that is absorbed by our cell. So our cell will have all the oxidized nutrients and also the waste, the toxins accumulated. So it will cause the cells to be weakened. Our cell will not be healthy anymore. And this is what happens to diabetes patient. Their cell accumulated a lot of the oxidized nutrients, toxins, and waste, which is caused by they don't have a good cell metabolism. So Dr. Nobre found out that the only way to improve diabetes is to let our cells absorb glucose, fats, and proteins, and then convert them into energy through burning. Okay, this burning process is very important. Like I've mentioned just now, if all the nutrients that we absorb cannot be converted into energy, so it will accumulate inside the cell and then being oxidized and then cause our cells to be weakened and affect our blood circulation. So in order to improve diabetes, is actually to target our cell to help them to carry out the cell metabolism, let all those nutrients convert into energy through a process which is known as burning. So how to assist our cells to burn? Like for example, if you want to burn a wood, like you want to cook, for the old style of cooking, we burn the wood for fire, right? Okay. So if we want to burn a wood, what material we need? We need fire and oxygen. So with wood, fire, and oxygen, we will be able to burn the wood to create a burning process. But what about ourselves? For the burning of ourselves, what we need? Actually, we need the same thing. But instead of the real fire, because it's very impossible to burn ourselves, impossible you walk into a fire with your own body, right? So the fire in this case is our reducing electron. So reducing electron is playing a role as a fire. So with reducing electron and oxygen and the nutrients, our cell will be able to carry out cell metabolism, which is very important for diabetes patients. Okay. Now, Dr. Nobre also mentioned the body fluid of diabetes patient is acidic, mostly oxidized, and lesser electrons compared to a healthy person. So like I've mentioned just now, why they have a diabetic problem is because of their cell metabolism and cause their blood to have a lot of toxin and waste, which means that the body fluid is acidic. Mostly oxidized because all the nutrients accumulate in the cell cannot be converted into energy. So they will get oxidized by the oxygen. And they also have lesser electrons because they already don't have enough reducing electron in their body. That's why they have all these kind of problems. Hence, glucose and fats inside the cell will not be burned and converted into energy. So the only way to solve this problem and to solve diabetes problem is to ensure that our cells are healthy and to ensure our blood pH is at the optimum pH, which is 7.4. So this is a picture I would like to share about the cell metabolism. So you can see that left side is the healthy cell, which is insulin effective. So you can see here that extracellular fluid is 7.4, which I've mentioned just now, that it should be at 7.4. It is the optimal pH for our cells to carry out cell metabolism. So like what Dr. Frida mentioned just now, insulin is actually to help our cells to absorb all the glucose, the fat, the protein. So you can see the receptor here. Once it receives the insulin, it will send the signal for the glucose, the fat, the protein to go in. Okay, so with the oxygen here and also our reducing electron, all these nutrients, especially the glucose for the diabetic patient, will be converted into energy. And this is because the cell can carry out cell metabolism. Okay. One thing that we can see from diabetic patient is, okay, like what Mr. Jim asked just now, some patient, their pancreatic cannot produce insulin already. So that's why they are taking injection through the artificial insulin. Okay. But why we say that this artificial insulin is actually not the actual treatment to help diabetes patient is because it creates a hallucination, like an image of these patients being treated, but actually they are not. Okay, what happened is when you inject the insulin, okay, remember the function of insulin, right, is to help all these nutrients to go inside our cell for cell metabolism, for burning, to convert into energy. So once those diabetic patients inject insulin, okay, the insulin will ask all these glucose, fat, protein to go inside. But because of diabetic patient, like what Dr. Nobre said, they already have lesser electron compared to a healthy person. So, reducing electron is our fire. It's very important to help us to carry out cell metabolism, to do the burning. But diabetic patient does not have enough of this electron. So even though they inject a lot of insulin to help them to force all these nutrients to go inside the cell, but they still don't have the fire to help them to burn, to change into energy. So what will happen? So all these nutrients will not be burned. They will slowly collect again. Like what I've mentioned previously, when it collects too much of these nutrients, they will be oxidized, and then will accumulate a lot of the toxin, the waste, and then slowly our cell, inside our cell, will become acidic, and then our cell will be weakened and will not be healthy. So when you go for testing, like testing the blood sugar, you'll find out that after injecting insulin, the diabetic patient, their blood sugar is under control, like become normal already. It's because they force all the glucose in the blood into their cells already. But what they cannot see is, even though they force this glucose into their cells, but the glucose is just collecting inside. It doesn't do anything. It's not being burned. It's not being converted into energy. So why I say it's like a hallucination and a fake image of they are being treated is because the blood don't have sugar. All the sugar is inside the cell, but they cannot see it. So they thought, okay, they are okay already. They're healthy. Their blood sugar is under control. They are being treated. But what happened inside their cell is the cell will become weakened because full of the oxidized things, the toxin, the waste. So this is the reason that will cause all the complications for diabetic patient. Why their kidney got problem, why they will have become blind, all the complications that you can see is because of this cell is not carrying out all the cell metabolism that is supposed to. Okay, so why Dr. Nobre Horiguchi said the only way to improve diabetic condition is to make sure that our cell is healthy, and also to make sure that our body fluid pH is always at this alkaline, and also to ensure our body has enough of electron. Because once the insulin transfer all this glucose into the cells, it need to be burned. It need to be converted into energy. Okay. So once, let's say diabetic patient, they do this reducing electron treatment, plus they go for insulin injection. So it will actually help them in the sense that insulin help them to force all the glucose into the cell. And then when their body has enough of reducing electron, this electron will help them to burn all the glucose. So there will be no glucose accumulate inside their cell. So which is why Dr. Vida mentioned just now, it will help with all the complications and side effects, because it will help the glucose to be burned and then to activate the cell metabolism. So your cell will always be healthy. It will not cause any problem to your body. When your cell is healthy, your body will be healthy also. And also because the glucose will be burned and be converted into energy, you actually don't need a lot of insulin injection to help you to force all the glucose inside. It will actually improve the efficacy, the effect of the insulin in diabetic patient, which is why when diabetic patient use this treatment, it will not only reduce the complication, it will also help them with their insulin intake. It will slowly reduce their insulin intake. Okay. So for a better understanding of the effect of this reducing electron, I will just share one of the case which I took from Japan, our Japan hospital, Horiguchi Hospital. This case is a 45 years old male. So you can see here at 26 years old, this man is diagnosed with diabetes. And 29 years old, he started the insulin treatment, which is the injection of the artificial insulin. 41 years old, he started to have chronic kidney failure and then started dialysis. This condition, if you remember what I said just now about the whole cell metabolism process, you will know why he has all these complications. It's because the cell has a lot of oxidized nutrients and toxin and waste inside. Okay. And at 43 years old, he already went overseas for kidney transplant and has serious rejection issues which affected the mobility and senses of lower part of the body. Because for kidney transplant, it doesn't mean that after you get transplant, your kidney will function well. Some people, they will have rejection issues. Their body cannot accept the kidney that they transplanted inside. So in this case, this rejection already affected the movement, the mobility, and the senses of the lower part of the body, which he may be numb, he cannot move properly already. Okay. And also he had vision and mobility problems due to orthostatic hypotension, peripheral nerve damage, angina pectoris, and diabetic retinopathy. So you can see at 43 years old, he has a lot of complications already, which all started with just diabetes, one disease, and then it lead to all these complications from kidney to the limbs, to the nerve, to the eyes. Okay. And since then, he depends on wheelchair and requires a nurse to look after him. So like he cannot take care of himself already. He needs someone to assist him in his daily life. And then he came, he went to the hospital in Japan, and then he received reducing electron treatment. Okay. So he also uses the treatment at home since July 2003. On the first week, he did each session 5 minutes and 8 times per day, which is the standard treatment. On the second week, he increased to 10 minutes. On the third week, he increased to 15 minutes. But in this case, the treatment interval, which is the rest time for this patient, is 90 minutes each. Okay. So he did this for long term. Okay. So this is the result from this patient. So you can see he started July, right? So the result here, which I highlighted, is May and June, which is before he did this reducing electron treatment. You can see his fasting sugar level is very high at 176 and 170, which is very high for fasting sugar level. HbA1c, which is also a measurement for blood sugar, is also high at around 7 lah, 6.9, 6.7, around 7 like that. Okay, and then you can see this one, the insulin units that he used, which is the insulin that he injected every day. So you see, after before breakfast 13 unit, after breakfast 5 unit, after lunch 7 unit, after dinner 11, and then June also. So total is 30, 36, which is a lot of insulin per day for his condition because he's a diabetic patient with a lot of complication. So since July, he started to use this reducing electron treatment. You can see the trend lah, the pattern of the sugar level. It started to lower down across the months until December. Okay, so it's like 6 months lah. Okay, half a year. So you can see from initially 17 something, finally he dropped to 148, which is under control already. HbA1c also slightly reduced. And the most significant one is the insulin intake. You can see from 30 something until 18, which actually reduced like almost to half of the insulin intake that he need to use already. Okay. As for the vision impairment, anemia, and also all the other complication, you can see here. This one is for the vision because he got vision impairment also. So like at first, her right eye is only can see 0.1 degree lah. And then after he uses this treatment, it improved the vision already. You can see it's up to 0.6, 0.4. For the red blood cell also, 300 something to 400 something, which is increased. Okay. And then hypotension medicine, which is the low blood pressure medicine from like 2 units per day reduced to 1 unit. Okay. And the bottom here is actually all the mobilities lah. Like initially he cannot move, he need to use a wheelchair, he feel numbness in the limbs. But after like 5 to 6 months of usage, you can see he can sleep well. At first, he slowly improved his walking. So at first, he needs a wheelchair. And he only can walk 10 meters unassisted, which is no person help him lah. He can walk alone for 10 meters. But after using, he can walk more without help from other people and less use of a wheelchair. And in November and December, he can walk up to 600 meters without any help from people. Okay. And also for the numbness in the limbs, after he used the treatment, he feel improvement already. All the peripheral neuropathy, the numbness in the limb, everything is improved. And another thing is the metabolic skill score. So for a normal person, it should be around 20 something lah, 20 something. But for this patient, you can see at first it's only 15 to 16, which is really low for the metabolic score, which means that the cell metabolism is very poor. The cell cannot burn the nutrients, cannot convert them into energy, which is why he has all these complications because of the cell is not healthy. Okay, but after he uses the reducing electron treatment, you can see it increased a lot until 20 something, which is the normal level already. So this indicates that his cell metabolism is improved significantly, which is why he can reduce the insulin intake. Her blood sugar is under control. All the complications is improved. So you can see lah, the real treatment, the real way, the true way to improve diabetic condition is through helping your cell to carry out cell metabolism. Once it achieves, it becomes normal. All the complications, your insulin intake, your blood sugar will be under control. So this is what I've extracted from Dr. Nobre's research. So anybody have any question? Anyone have a question for this part? If don't have, then we will just move on to the next session already. Okay. Then I'll invite Madam